Hello all, this is DrVNandhini, MBBS, DNB, OBG with specialization in infertility and laparoscopic techniques. With more than 6 years experience, currently working in Surakshaa Hospitals.
Welcome to Surakshaa Hospital, doctor. I think it was an amazing thing that you were able to spare some time in the interest of the viewers, and we will definitely going to have a very healthy discussion on a hot subject like PCOS or PCOD. Today it has been a nightmare for the young girls getting into PCOS and PCOD, and in this particular discussion, doctor, I would like to ask you what actually is the PCOS, and would you mind explaining on this?
Yeah, definitely. PCOD is called polycystic ovarian syndrome. It is a common reproductive age group problem. It is a hormonal imbalance where the most common characterized by irregular menstrual cycles, raise in male hormone levels called androgens with polycystic ovary features in ultrasound.
Okay, that's very nice of you, doctor. We like to have much more clarity on this subject. What are the main causes for the PCOS, doctor?
Not exact cause, but there are many contributing factors like genetic factors, improper eating habits, hormonal imbalance, lack of physical activity. Okay.
So this is very evidently seen in the modern ladies and girls, irregular habits and lifestyle problems have been very predominantly there. But unless until they know the symptoms, doctor, how they will be able to understand. That's the reason I would be very happy if you can definitely say what are the symptoms, common symptoms of the PCOD or PCOS.
Most people present with irregular menstrual cycles, weight gain, acne, hair loss, black patches over the neckline, that's called acanthosis nigrosis. Infertility is the main problem for reproductive age group.
This is very scary, doctor, back patches on the neck and infertility and all that. And having know the symptoms, doctor, there is something very important. How do we actually diagnose this?
The diagnosis has 3 criteria. Among 3 criteria, 2 criteria to be met to be called as PCOS or PCOD. So in that, irregular menstrual cycles are one. Second is polycystic ovarian features in the ultrasound, where the ultrasound shows multiple cysts in the ovary. Third feature is increase in the male hormone levels called androgen. Among these 3, 2 criteria has to be met to be called it as or labeled it as PCOD or PCOS.
So this is quite interesting, doctor. You very clearly said about the 3 criteria. Out of the 3 criteria, if any 2 criteria are positive, then they'll add up into the PCOS and PCOD.
Definitely they'll be labeled as PCOD.
Then in that case, what are the complications associated with the PCOS, doctor?
For reproductive age group women, infertility is the most common problem. For advanced age group people, metabolic disorders like cardiovascular problems, diabetes, and some cancers like related to ovary, mainly endometrial cancer. These are all for advanced age group women. So it has to be corrected as early as possible.
Early collection is definitely better for any disease for that matter. And how does this PCOS affect the fertility, doctor? Because most of the girls who are married and all that, in case if they are planning for a child, one of the commonest thing they find off late is the fertility issue. So 3 years, 4 years, 5 years also they don't get into a pregnancy state. That's where they keep worried about it. And of course the lifestyle is gone for a 6. So how does this PCOS managed or treated, doctor?
For infertility per se, because of hormonal imbalance, there will be not proper ovulation will not be there. This causes problem for conceiving. Most of the people with proper weight management and physical activity, this can be pregnancy can happen naturally. Otherwise, if not correctly treated, they might land up with assisted reproductive techniques also. Having
understood the PCOD or PCOS was these kind of things which you already answered. And the thing which I would like to know is, you have been talking about lifestyle. And more harping on the lifestyle for the PCOD and PCOS people. What kind of changes in the lifestyle is going to help the PCOS, doc?
Regularization of eating habits. With low carbs, low sugars. Physical activity of at least 1 hour activity per day. Walking, jogging, muscle strengthening exercises. This will control PCOD to an extent. Regular sleep patterns, stress avoidance. This will control PCOD to major extent.
Because the common things, doctor, whichever patient comes to you, or for any disease for that matter, they always have a one question common. Doctor, is this PCOD or PCOS will be completely cured? That is the question they are going to ask you. But I would like to ask you the same question, doctor. Do you think that PCOS or PCOD can be completely cured?
There is no cure for PCOD, but if managed effectively by lifestyle changes, physical activity and all, it can be controlled to a great extent that it will not be seen in further scans also.
Okay.
But there is no permanent cure per se.
Okay. So normally people say, you can really control a cub, but not the lion.
Correct.
Okay, prevention is better than the health, they say. So if that is the case, especially in case of PCOS, doctor, okay, how early the diagnosis is possible with the PCOS or PCOD? How early the lady should be able to approach?
If the woman notices any slight imbalance in her menstrual cycles, or any hair loss, severe hair loss, acne, facial hair and all, this indicates that some hormonal imbalance is going on. So they have to come to gynecologist to know the reason. The earlier the consultation, the better the treatment.
Absolutely. It was nice talking to you.
Thank you, sir.
And I think my questions and your answers were very apt. I think people who are watching this should be able to get at least a good idea about what is PCOS and PCOD.
Yeah.
And since it has become a very hot subject for the current woman, unfortunately they have been suffering. So earlier is always better, and I wish that people should be able to understand the importance of this particular problem, and they should be able to approach the doctors as early as possible, as you rightly said. Since there is no complete cure for this, it can be only managed. So earlier the better. So thank you so much, and thank you very, very much for the help which you have given to us. Good night, ma'am. Thank you.